Hey guys! Welcome back to my channel and welcome for those who just pop into my video. I am Jamie. I'm a transgender from Thailand and I make video about beauty, fashions, and transgender related topics. So the topic is about breast cancer. There's no one talking about breast cancer at all in the community. Like no one really talking about the effect of hormones that could turn you into breast cancer. Like the risk of breast cancer is real. The reasons I want to talk about this because like I have a friend, like I knew her since like I was like 14, 15. So very long time. Then I came across her news that now she has breast cancer, which like very surprising and very sad. She's a transgender. I think she started using hormones way before me, and her like the hormones has a lot of effect on her. Like she developed like a lot more breast tissue than me. Like I don't actually develop any breast tissue at all. Seriously, like none. Like hormone doesn't produce that kind of effect on me. So after I knew that, I was like, okay, I want to let people know that transgender can also get breast cancer. Like breast cancer risk is like woman and then transgender and then male. So I was very sad to hear that, and then she's in like a very late stage of breast cancer. She had her breast removed and now she's doing a chemotherapy. And the reasons I want to do this because I want everyone to examine your body. Like if you're using hormones, you need to see your doctor regularly. If anything abnormal happened to you, anything, do seek doctor advice. Like for example, after I hear news, I suddenly have like a tiny dark spot on my nipples. Like suddenly I had like a dark spot on my nipples. I was like, okay, what is this? Like breast cancer, like skin cancer, like whatever cancer that is. Because I use hormones, and even though I don't use that many hormones, I still get scared. So I went to see a doctor yesterday, especially in breast part. So he had a look and he said, okay, everything's fine. It's probably just a mold. Like, yeah. So and he was like, he said it's like nothing, and then he explained to me that like the risk of breast cancer is mainly about breast tissues. Like a male doesn't have that many breast tissues, so they have a lower risk of developing a breast cancer. But still, male can have breast cancer. He said he has many patients that are males and still have breast cancer. So I was asking him about hormones. Like he said, sure, it increases the risk of you getting breast cancer, but it's still very low. But you should be aware of your body. If anything changes in your body, like in your breast and it has a lump, sure, you need to see a doctor right now. So I went to see him. He examined my body. He said, fine. Even that, so like, can we do something else? So he said, okay, that he can send me to get an ultrasound and check if there's anything underneath my breast. So I did that. I went and get ultrasound on my breast, check my implants, check if there are any cysts or anything underneath that dark spot. So everything was clear. There's nothing in that area. It's just a mole. So be aware that a mole can actually get into your nipples. But I think he said, okay, if anything happens, if there is more moles, if it expand, if it's grow, then sure, please go and see him again. Or see a dermatologist and they can examine me if there's anything else that they could do. So yeah, that's pretty much a story. I really feels like this topic hasn't been discussed enough, and that's actually take a toll on me on thinking about using hormones. Like I feel like using hormones, I will use hormones less, and eventually I think it will stop because like after turning 30, I feel like hormones doesn't actually do anything, as I have been saying that many times. Hormones actually don't do anything for me. And anyway, I just want to sum up that be aware of your body. If anything changes, especially around your breast, if you develop a lot of breast tissues, I know that like there are a lot of people who develop a lot of breast tissues from hormones, then you have a little more risk than other people. Then you should see a doctor. If possible, you should get your breast check every year, or maybe every 2 years if that's possible, because Hormones do increase your risk of breast cancer, and it's real because my friends had it. So be aware. Stay safe, and I'll see you next video. Bye.